BT's Body in Balance is sponsored by Canada Diagnostic Centres, offering MRI, X-ray and ultrasound services in Calgary and Okotoks.
Tomorrow is World Contraception Day, and these days a lot of women, particularly millennials, are making choices about their birth control based on what they're finding on social media and the internet. Our health specialist Leah Sarich is here now with why it's important to have a conversation with your healthcare provider about what kind of contraception might be best to fit your lifestyle.
Right?
Yes, go to a credible source.
Exactly. It's all about accurate information. So that's why we're talking about this. It is World Contraception Day tomorrow. And let's put this in a little context. Think about this. Women are going to be making choices about their reproductive health for about 30 years. So that is a really long time. And of course, over that length of time, it's a very good chance your needs are going to change and your lifestyle is going to change. So it's really important to go back to the family doctor and say, hey, you know, like, what about this option or what about this option? And get accurate information. Accurate information. So it's still great to talk to your girlfriends, still great to go online and go on social media and find out what's happening, but you really want to confirm all of that information and make those decisions with your healthcare provider. And these days, there are so many options for contraception, there's a lot of choice. And doctors are now dividing these options into short-acting methods of contraception and long-acting methods.
For a woman who's really just needing short-acting birth control for a year or less and she can tolerate pregnancy, then oftentimes we will recommend things like the birth control pill, the NuvaRing, the patch, condoms. If a woman is requiring birth control for at least a year or more and it would be very important for her not to be pregnant, then oftentimes we're recommending the longer-acting forms of birth control, which are what we call LARCs, long-acting reversible contraception, which includes things like the IUDs.
There's an IUD right there. So there are a lot of myths out there about the IUD, which you will find out online. And the reason that started is because of a faulty model that was put out in North America in the 70s. It led to more infections and more scarring and things like that. So it got a bad reputation here in North America. But Dr. Mongat tells me, you know, that same model was not released in certain countries in Europe, for example, so they never got that bad rep over there. And the use is really quite high in Europe for the IUD. And it's actually growing here as well. It's up to about 8% now. And as women start to get that group confidence in this product, they expect this to go through the roof. I mean, if you ask any OBGYN that's a female what kind of contraception she's using, very good chance it's an IUD. So they really do work very, very well. They work well, they're easy to use, and really that's one of the main reasons why an IUD is a doctor's first-line form of contraception these days.
An IUD just is a device that sort of sits inside the uterus and it offers long-acting contraception. So these can stay in place anywhere from 3 to 10 years, depending on the particular model that a woman chooses. But they are reversible. So if a woman's needs change, if she desires pregnancy or doesn't like her IUD for any reason, she can have it removed whenever she likes. She doesn't have to commit to the full time frame.
So a really nice option for a lot of women. There are two kinds of IUDs, one which is copper, which has no hormones in it at all, and then there's the hormonal IUD, which is really quite common these days. It releases a small amount of progesterone hormone into the uterus, but that's about 1,000 times less than the birth control when you look at the hormone levels. And because it's released locally into the uterus, that hormone is not traveling through your entire body.
What kind of side effects do we see with an IUD?
Well, with a hormonal IUD specifically, it has a side effect which many women might actually enjoy. In fact, it reduces blood flow by about 80 to 97%, so a lot of women might actually like that, which is why the hormonal IUD is often used to treat heavy periods, for example. There's also a small risk, though, of an IUD, and this we have to talk about because this happens with any kind of drug or intervention of any kind. So there is a small risk of infection when it's being inserted, but most doctors obviously can take care of that, no problem. There is a risk of perforation, so that's poking a hole in the uterus, but that doesn't happen very often, only about 1 in 100. And then there's a risk of expulsion, so this is the body cramping, trying to get rid of that foreign object, that IUD, and that happens only in about 5% of cases. So there is a small risk there, but as we know, the benefits of the IUD are very huge, which is why, of course, it's becoming very popular among a lot of women and a lot of doctors. Bottom line here is World Contraception Day is tomorrow. Get an informed opinion on what your choices are and make that choice because, bottom line, an unwanted pregnancy is a life-altering event.
It certainly is. More information on your blog, as always, Leah.
As always, you bet.
breakfasttelevision.ca. Mike Yanni is wrapping up his adventures in Cabo the right way. Mike?